for your inspiring words. I said to you, you're incredible as I was walking past you, and I believe that with every fiber of my being. We are absolutely lucky to have you. As the mayor mentioned, it is June, right? It's the beginning of Pride Month, and we felt like having this conference in June was the right time. We felt like it was the right time to be able to talk about LGBTQIA plus health and to be able to invite everyone in to hear the results of all of the data that we've collected. Our opening session today will be presented by Chrystina Obleschuk. Chrystina serves as the Director of Programs at Bradbury-Sullivan Center. In her role, she oversees all of our center's programming. That includes health education, the Health Needs Assessment, youth and family engagement, community outreach, community groups, as well as our career gallery and our career library. She's busy. We're all busy, but we're so happy to be here with you today. Part of what we do at the center is use some of the data that you're going to hear about today to build new programs, to build new services, and to bring information to our community, hear what our community has to say, and then give them what it is that they're asking for. I am incredibly grateful that she is a member of our team and for the work that she does tirelessly for our community. Please join me in welcoming Chrystina to the stage.
Thank you all for being here today. In today's political climate, I am more excited than ever that we're able to host this event here in Pennsylvania. You obviously all cannot read the pin on my jacket, but I will read it to you. It says, respect existence or expect resistance. And I think that that is a great motto for today, is please learn today about how to respect existence, or you're going to face resistance. So thank you all for being here. Before we get started, just like a little activity to see where folks are from. So show of hands if you have traveled all the way from the western side of the state. I know there's a few of you out there. If you're more from the central part of the state. If you're from the northeast part of the state, we are in the northeast. If you're from Lehigh County, that's the northeast part of the state. And who are our folks from the southeast? Thank you all for traveling here today, especially those who have come from long distances. PA is a bigger state than a lot of people think. So I'm gonna quick give you the spiel that if you saw me at an outreach event, this is what you would find out about the center. So I'm the Director of Programs at the center. We do a variety of work within the community, including hosting our community groups. We host Lehigh Valley Pride, other events like Allentown Out and Proud. We do the PA LGBTQ Health Needs Assessment, which is what I'm here to talk about today. And we're hosting today's summit. So that's just a little overview of who we are and what we do. We're located in downtown Allentown, just a few blocks from the PPNL Center. So today, just so you have some expectations of what my presentation will entail, we're going to go over the Health Needs Assessment briefly. There is not enough time in the day to go over everything that is in the booklet, but you all have a copy in your bags, so please feel free to peruse the Health Needs Assessment at your leisure. And I just want to say, just because I don't cover something today doesn't mean it's not important. I just only have so much time. Please use the data. We've collected this data so that it can be used. You can email me or the folks at PHMC who are scattered throughout the room, and a few of them are presenting later today. And you just have to fill out a form, and then we share that data with you. If you have any questions about the assessment that you think of later or about getting the data, you can ask me, or like I said, those folks from PHMC. And my last call out is that we will be collecting data again in 2026. So if you have the capacity to partner with us, please scan this QR code. I also have it later on in the presentation, so you will have another opportunity to scan it, but this is just like a basic form for me to collect information, so when it comes time to be collecting the data, I can reach out to you and ask for your assistance. So now we're going to move into what is the Health Needs Assessment for those who don't know. So a little history of the Health Needs Assessment is that in 2015 to 2016, 6 regional surveys were conducted, and then in 2018, the first statewide survey was conducted. That was then repeated again in 2020. We had a record number of respondents in 2020 because of the pandemic and folks being at home and having the time to fill out the survey. In 2022, we had a little over 4,000 respondents, and we were able to offer the survey in Spanish for the first time. I just also want to take this moment to say that the only reason we are able to do the Health Needs Assessment is because of our collaboration with PHMC. They do all of the background work, cleaning the data, building the survey, and then our end of the work is going out to prides and working with our 40+ partners across the state to promote the survey and get people to fill it out. There is no way that this would work without both pieces of the puzzle. So I just want to give them a shout out. And why is the survey important? Lots of data sources are being removed from government websites. Even before that, they weren't collecting information about our community. They weren't collecting that SOGI data. And so this gives us an opportunity for our voices to be heard. And so, yes, next slide. Just some notable results from this year's assessment. The data was collected from May to September of 2024. We had a little over 3,000 respondents. 17% of which did not have a doctor or a healthcare provider, half of which have experienced physical or sexual assault in their lifetime. Nearly 1/3 of the respondents had experienced unstable housing in their lifetime. 82% of respondents facing at least one primary risk factor for HIV are not currently taking PrEP. 69% of those who currently smoke cigarettes or e-cigarettes were interested in quitting. Nearly 3/4 believe they can have a big or moderate impact on the community. And nearly 95% are registered and prepared to vote. So there's a lot of positive data in this data set and a lot of data that shows that there's work to be done. Before I kind of jump into the data, I'm going to share a video with some perspectives from one of our community members. I have a couple of videos throughout the presentation because we thought it was important that you hear from the community and not just me today. So I'm going to get that started.
I consider myself genderqueer and non-binary. That being said, I tend to look like a rather masculine cisgender male person. I guess one of the struggles is that people just assume, and that's not just in healthcare, but that can be in general, but certainly can affect healthcare too. The LGBTQ+ community is so broad and encompasses so much. For example, I'm not really looking for any surgeries or hormones. That being said, for many people, they are looking for stuff like that. There's so many different things, types of vaccines that you can get for prevention, testing, there's treatments. There's so many different needs within that LGBTQ community. It all depends on the person. The healthcare needs of the community is very broad. If the general public is more educated and has more knowledge on the issues that are facing our community and knows how to provide the proper care to our community, that will better everyone as a whole.
So now I'm going to jump into some of the demographics just to provide some context for all the data. When people were asked to self-identify their sexual orientation, queer was the most popular self-identified sexual orientation, with 24.2% of folks responding as queer. And as you can see, there's this is the distribution of self-identified sexual orientation. We also collected data, obviously, on gender identity. 1/3 of respondents identified as transgender, which I think is really helpful to our use of data to really be able to say a lot about the transgender community. So I am very happy that we have that many folks that responded. We also had more than half of Native respondents identify as Two-Spirit, which I thought was an interesting stat to pull out of the data. And then just some other notable demographic information. So 4.9% of respondents identified as intersex, which makes the 2024 PA LGBTQ Health Needs Assessment the largest known sample of people with intersex traits in a Pennsylvania database, which is really awesome that we can say that about our data. The race distribution is relatively similar to the population in Pennsylvania. Black and Asian representation is a little bit smaller than in the general population of Pennsylvania. And then American Indian, Native American, or Alaska Native is overrepresented, but I do think that that's another kind of cool thing about this data set is that oversampling of that population allows folks to use that data and actually look at how is the American Indian, Native American, and Alaska Native population, specifically within the LGBTQ community, affected by the healthcare industry. And then there's also an oversampling of the Hispanic and Latino population. 1 in 4 respondents reported a lot of difficulty with everyday tasks. 49% identified as neurodivergent. And the majority of respondents had some level of college degree, so I do think it's important to note that our sample is more educated than the average population. We're going to move into another video from one of our staff members talking about their struggles with our healthcare system.
My name is Guinevere Toller. My pronouns are she, her, and I am a group facilitator here at the center. I came to the center looking for resources on getting a name change, getting hormones, and then I became a regular member. I took over as facilitator and started coming to the center even more. It's particularly important for us to have a health summit because within the healthcare industry, we have very specific problems that affect us as individuals and as a community that we find it very important to address. I've been harassed. I've been denied job opportunities. I have been denied healthcare coverage before, specifically on just being trans. The whole process is filled with a lot of bureaucracy. Depending on where you go, they require letters from multiple therapists. It can be incredibly expensive. There's a lot of barriers to access. Bradbury-Sullivan is a safe space. We bring people in here and make them feel as safe as possible to participate in the community, make sure that they know that they're safe to be who they are here, and also help get them the resources they might need, find them advocates when they need advocates, find them healthcare providers when they need healthcare providers, and find them community when they need community, which we all do. I want people to have access to the care that they need because it's life-saving. I've known a lot of folks who suffered through not having it. It's truly life-saving care that everyone should have access to if they need it.
So as you heard Gwen talk about, insurance can sometimes be a tricky issue for our community, particularly the trans folks within the community. When we asked respondents on the survey whether or not they had insurance, 4% said that they currently have no form of insurance. And so that is definitely something that can be worked on. Getting that number lower and lower each time we take this survey would be awesome. When it comes to primary care, 21.7% have not visited a doctor in the past year. And that is even higher for those who identified as having a disability. Almost 28% of them had not been to a primary care provider in the past year. Over 1/3 had not received their annual flu vaccine. And that is a little concerning because in the 2022 data, we had extremely high rates of vaccine efficacy. So that's definitely an area that we should all work in about our education around flu vaccination. And then nearly 1/3 reported experiencing symptoms of long COVID. And the most common symptoms of that were tiredness and fatigue and brain fog. So taking care of yourself can be hard to prioritize when your basic needs are not met. And so on the following slides, I'm going to talk about some of the basic needs that aren't being met for our community. Overall, 9 in 10 respondents are at least somewhat interested in incorporating healthy living strategies into their life. However, 3 in 10 respondents reported that their overall health is poor or fair. And you can see that the healthy living strategies respondents were most interested in were getting enough sleep, which I think we can all probably relate to, especially getting up early this morning for the conference. I woke up before the sun did, and that was rude. Active living is also pretty high up there, and then you can see some of the other issues that people are interested in getting more information about. Housing is one of the #1 requests that comes into our referrals line. We are every week getting an email or a phone call from somebody who needs LGBTQ affirming housing. And PA currently does not have any anti-discrimination laws when it comes to housing. So that is an issue that our community is facing every day. As you can see, 30.2% of all respondents experienced housing instability in their lifetime. And that is higher for all of these different intersectional groups. So for disabled respondents, people of color, neurodivergent respondents, and transgender respondents, they all experienced higher levels of lifetime unhousedness. Of those respondents who reported having housing instability in their lifetime, 1/3 had experienced that instability in the past 12 months. This is not an issue that happened at some point in their life. This is happening to folks right now. And 17.9% of respondents identified housing as one of the top community priorities. So it's not just housing. The LGBTQ+ community is struggling to have all of their basic needs met. Just over 1 in 4, or almost 1 in 2, have not enough or just enough to make ends meet at the end of the month. And that jumps up to, my brain clearly did not do the math right here, but up to 55% for neurodivergent respondents and 63% for respondents with a disability. And 39% of respondents agreed with the statement, "I worried whether my food would run out before I got money to buy more." So some additional issues that people address as a barrier that they faced due to cost are skipping mental health services, skipping routine care, skipping meals, or at least cutting the size of their meals, not seeking dental care when it's needed, not filling a prescription, and not seeking help for a substance use concern. For me, after I read through the data as it came out, the most alarming result of the survey was that 51.1% of respondents had experienced violence in their lifetime. Again, those intersectional identities have experienced it at even higher rates. Of those who reported having experienced violence in their lifetime, 44% experienced violence from a family member, partner, or spouse. The top community priority on this survey was violence. And I want to remind you that this data was collected before the presidential election passed last November. So the fear of violence was high before all of the legislation that has been coming through in the past 6 months. 60.5% of transgender respondents to the survey reported avoiding using public bathrooms, which has health consequences. So when and where do folks feel safe sharing their LGBTQ+ identity? 57.1% of respondents did report feeling safe more than half the time to share their identity. The place that people felt the least safe to share their identity was at work. 36.4% of respondents reported feeling unsafe sharing their identity at work. 83.5% of respondents reported feeling affirmed by their friends, but only 42% of respondents reported feeling affirmed by their neighbors. So just to provide some context about the spaces in which folks feel comfortable sharing their identity.
I am a trans individual, female to male transgender. I'm also gay. Sometimes healthcare professionals will ask very uncomfortable questions, especially to people of trans experience, things that just aren't really relevant to what you're trying to talk to them about. A lot of times, healthcare professionals will circle back to hormones and kind of blame hormones for unrelated medical issues, and it's a hurdle that I've heard from many different trans people. I've experienced it myself too. Kind of just learning to advocate for yourself and pushing to get answers when you need them, and try to reiterate that being trans and being on hormones isn't necessarily a cause for everything. A big thing I think is needed is having openly queer affirming providers. There is a very big lack of providers that outwardly say this is a safe space. So a lot of times people are just scared to go to the doctor because of negative experiences coming out to their providers. My hopes for the future of health for the LGBTQ+ community is an easy time for people who are trans or gay or queer of any kind to be able to find providers without fearing that they are going to walk into an uncomfortable or unsafe situation, that people are able to get simple access to care without a bunch of unnecessary questions, and people don't have to spend so much time researching and looking for an affirming provider. They can just go to the doctor and not have to be worried about it.
So Max's story is not an isolated incident. We see this reflected in the data as well. 17.9% of respondents reported not being out to any of their providers. While a majority of folks did report being out to at least one of their providers, a lot of people were out to none or only some of their providers. Among respondents aged 25 and under, 29.5% had not disclosed their LGBTQ+ identity to their provider. So the younger community does not feel comfortable sharing their identity with their provider. Many LGBTQ+ folks have experienced a negative reaction from their provider when they disclose their identity. So you can see that in the graph to the right. 33% of all respondents have experienced a negative reaction, and then there are higher rates among all of those intersectional groups again. 2 in 5 respondents feared seeking healthcare services due to past or potential negative reactions from providers, and that number jumps up to 3 in 5 for disabled respondents. So we have a lot of community members who might have healthcare issues that aren't getting addressed because they're afraid that their provider is not going to be affirming. Accessing an affirming provider is just not always possible. The most common barrier to care among respondents was a fear of a negative reaction from their provider, but there are other reasons that people couldn't access affirming care. 13.3% could not find affirming physicians. 10.6% do not have an affirming physician covered by insurance. And 10.5% reported that affirming providers were too far away. 38.6% of all respondents to the survey identified access to welcoming care as a top community priority. That was the second highest top community priority. So this is definitely an issue that we all need to be working on. Similar barriers to care were experienced when it came to mental health, but I'm also going to share some of the quotes that respondents share. I would need a neurodivergent affirming mental health care. Low ability/full wait list when using Medicaid. I depend on family who would not accept it, referring to mental health care. So there are a lot of things preventing folks from accessing affirming care. Now we're going to move into mental health and substance use. Historically speaking, in my time at the center, mental health has been the top issue found on the health needs assessment. This is the first time that in recent years that something else has beat out mental health as a top priority. But don't worry, mental health is still high up there. 1 in 4 respondents rarely or never receive the emotional support that they need. 7 in 10 respondents have experienced a mental health challenge in the past 12 months. So nearly 70% of all folks who filled this out identified that they had a health challenge in the past 12 months. When it comes to getting care, transgender respondents actually received mental health care the most frequently, at 67%. And those who identified as gender fluid or as a man received it the least often. If we look at mental health challenges by age, you see that the younger folks identified having more mental health challenges than older folks. This could be for 2 reasons. It could be that younger folks are having less mental health challenges. It could also be that older generations are less comfortable talking about their mental health challenges. So that's just important to keep in mind, is some generational differences in that comfortability talking about that issue. Younger respondents were also more likely to report having ever thought of harming themselves, having less life satisfaction, and feeling left out more often. Like I said, mental health was still high up on the top community priorities list, with 36.7% of folks identifying depression and anxiety as a top community priority, and suicide and self-harm as a top community priority. One of the things that we do at BSC is we host our community groups. They really help to break up the isolation, bring folks together, and to build community. This does make an impact on mental health, and we do use the health needs assessment when we apply for grants for these programs. So if you are running community groups, you can also use this data to support your grant applications and support the need for community groups like this. So let's talk a little bit about the data for substance use. Nearly 1 in 4 respondents reported binge drinking in the last 30 days, and 8.5% reported doing it at least weekly. Many respondents reported using drugs in the past year, with marijuana being the most popular drug of choice. While 1 in 10 reported seeking treatment for alcohol or drug use, over half of those who have sought treatment reported a negative experience with a provider. And 43.9% said that their negative treatment from a provider was due to their LGBTQ+ identity. And 44.9% of POC respondents reported it was due to their race. The majority of respondents, however, think that individual and group support are the most important services for harm reduction and recovery. For those in the room who do not know, the LGBTQ+ community has been historically targeted by big tobacco, and so we have higher rates of tobacco use among members of the community. This gives you an idea of what tobacco products folks in the community are using, with cigarettes being the most popular. 13.9% of all adult respondents smoked some days or every day. 23.8% of those 17 and younger had tried an e-cigarette or vape product. And 27.6% of respondents in Southwest PA reported smoking cigarettes. By far, Southwest PA had the highest smoking rate. The next highest is 16.3% in Northwest PA. 17.8% of transgender respondents reported smoking cigarettes. 21.6% of respondents of color reported smoking cigarettes. And 17.2% of gay respondents currently reported smoking cigarettes. Just to give you some context of what intersections have the highest smoking rates. So the good news is, like I had mentioned before, 69% of those who currently smoke are interested in quitting. And of those 69%, 35.1% are interested in quitting in the next 6 months. 21% of respondents do not think it is important to include vapes in smoke-free policies. While this is not great news, I'm not terribly surprised. The tobacco industry has done a great job of marketing vapes as safer than cigarettes. And so that is definitely an issue that we work on trying to communicate, and that I hope you all are able to communicate in your work as well, that vaping is just as dangerous as smoking cigarettes. 67.3% and 64.7% think it is very important to protect workers and the environment from smoke exposure and cigarette and vape waste. 80.3% believe it is at least somewhat important to create smoke-free Pride celebrations. So this data kind of goes in line with a lot of the tobacco work that we do at the center. So we currently are doing a campaign targeting youth focused on the impact that the industry has on the environment, and also just in general, the exploitation of the industry on our community. And then you can also see some of the imagery we use for tobacco-free prides, that every march starts with a single step. Take one step on your smoking journey the same way that you take one step in a pride march. So trying to, use the same way that the tobacco industry uses fun colors and fun advertisements, we're doing the same in our public health education. So just some other health concerns that are on the survey. Like I said at the beginning, I don't have time to cover everything. Other issues that you can find in your booklet are sexual health, including HIV and pregnancy, cancer, health screenings for chronic and infectious disease, community engagement, and appendices with focuses on various intersectional identities, as well as discussion and recommendations. So, if you are sitting there thinking to yourself, what can I do with this data? One, you can scan the QR code and become an HNA partner for 2026. I told you it would come back. You can use the data to be an advocate or to apply for grants. You can support your local LGBTQ+ community, attend a Pride, volunteer at Pride. You can also let today be the beginning. Don't let this be the end of your LGBTQ+ education. Don't let today be the end of being an ally. You have to take the things you learned today and use them in your work.